Joining us from Capitol Hill on C-SPAN's Newsmakers program is Republican Senator Bill Cassidy of Louisiana. Senator, thanks very much for being with us.
Steve, thanks for having me.
And joining us here in our studio is Jennifer Habercorn of Politico and Melissa Adias of CQ Roll Call, both on the healthcare beat. Senator, let me begin with the Supreme Court ruling of King v. Burwell, expected at least by the end of this month. If the court rules that subsidies are illegal, what's the Republican alternative?
Well, obviously leadership's coming out with a plan that's leadership's plan. I've introduced something called the Patient Freedom Act, and I would like that, of course, to be the principal force of our response. In brief, the Patient Freedom Act repeals the individual and employer mandates, and by doing so, it lowers cost, further lowers cost by returning jurisdiction control over insurance back to the insurance commissioners in the states where it was before Obamacare put on mandates. And then we take the money that the state ordinarily would receive and we distribute among those eligible for credits, and by doing so lower the cost of insurance. We also give patients protection by giving them portability between plans, by giving them the power of price transparency so that someone can know the price of something before she has to pay for the test and doesn't get a bill 6 months later, and protection against pre-existing conditions.
Do you have any sense as to what the court will decide?
I do not. Of course, when it says state exchanges, to me it seems self-evident. It would mean state exchanges. And Jonathan Gruber's videos seem to suggest that was done on purpose, despite protestations otherwise from the administration.
Let me turn to Jennifer Habercorn of Politico.
Senator Cassidy, it's nice to talk with you.
Jennifer? I'm
wondering, you and other Republicans have said that if the court does rule for the challengers here, that you don't want all these people, the 6.4 million people, to be out on the street without any health insurance coverage. I'm wondering, you have a plan, this leadership plan that you've talked about. There's other groups of lawmakers with plans. How close are Republicans to having one cohesive solution that you guys can present, not only to members, but to the public and say, this is our alternative, or this is how we want to address this ruling? The
specific point you mentioned, that there is commitment so that those folks who are currently receiving subsidies to purchase insurance, by the way, that Obamacare mandates have increased the cost of dramatically, that they would be held harmless. We don't want a woman in the middle of chemotherapy to lose the insurance she needs to pay for the care which she must receive. And there is a consensus that we are going to hold that woman, that family, that person harmless. As regards to whether or not there is a replace, the decision against Obamacare would effectively repeal a portion of Obamacare. I think what there is not a consensus on is whether we should put forth a plan that would replace that segment. The Patient Freedom Act replaces that segment with pro-market reforms, but I can't say that all have signed on to it.
And it seems like one of the issues is how you protect those people. I mean, some people want to restore the subsidies, and some people are worried that doing so would be seen as embracing Obamacare. Do you feel like the party can get together in one cohesive voice on that? I
do think so. These are human stories. The Obama administration implemented the law illegally. That's what will be determined if the Supreme Court rules against them. And folks are now paying dramatically higher premiums. Premiums have skyrocketed since Obamacare was passed. Although the cost of health care, the president speaks about the cost of health care being flat, and he's right. It started before Obamacare, but he's right. The cost of premiums have gone up like this. Most recently with premium increases of 20 to 60% on the exchanges across the nation. Folks want to hold her harmless. There's always going to be someone who disagrees. But as a rule, we recognize that she didn't do anything wrong. It was the administration, and we shouldn't penalize her.
Melissa Adias also covers healthcare policy for CQ Roll Call. Melissa?
Thank you, Senator. Your plan also has a repeal of the individual mandate, like you mentioned, and I know a lot of Republican plans have that element included, and it seems like something that's very unlikely for President Obama to actually sign. So I'm wondering, is there any room for middle ground here when the two parties actually have to sit down and figure out what to do about these people who are losing assistance?
So, Melissa, sometimes you have a sense that the president is protecting the law and not protecting the patient. The individual mandate has resulted in 33 million people being uninsured. In the state of Louisiana, our rate of uninsurance was 20% before the law passed. I'm told it is 20% now. Now, if the goal is to give access to coverage, the individual mandate has failed. It has failed. Premiums are going up in some states as much as 60%. The rationale is that this was how premiums would be held lower. In the Patient Freedom Act, we give states the option, as they expand coverage, to enroll someone unless they choose not to be. Now, by so doing, if you look at 401k data, it shows that under that system, you have much higher participation rates than if people have to opt in, if you will. I think under the Patient Freedom Act, which, by the way, that provision is also in the Burr-Hatch proposal, another Republican proposal, would give you more coverage than with individual mandate. Now, if he just wants to protect the law, he's going to veto it. But if the real goal is to take care of patients, I sure hope he'll look at a different way of giving people access to coverage, a way which, frankly, couldn't do worse than what his plan has done.
And Senator, without that coverage, one of the fundamental arguments has been that those without insurance use ER rooms as their primary care physician. How do you get beyond that? Because often that is, as you well know, causing such a significant increase in healthcare costs.
There's an irony here. The administration has said that, oh my gosh, the rate of uninsured is the lowest it's ever been. What they don't say is that most of those folks are on Medicaid. Most of the newly insured are on Medicaid. And we're also seeing is that Medicaid pays providers so little that still the person on Medicaid does not have access to a physician. She is still going to the emergency room. This is the worst of all worlds. We have the state taxpayer now paying for someone to go to the emergency room because the insurance they're on gives the illusion of coverage without the power of access. Under the Patient Freedom Act, we take the money that a state would receive if they expanded Medicaid, and the money they would receive would people sign up for Obamacare, and we actually give credits used to buy a health savings account with first dollar coverage. Obamacare, you have a $6,000 deductible. Under the Patient Freedom Act, you would have first dollar coverage, and the academic literature shows that the individual learns that, my gosh, if I go to the urgent care center, I spend less, I save more, I have more in my HSA. We think the Patient Freedom Act is a better way to go than the $6,000 deductibles of Obamacare or the expansion of Medicaid, which is, again, the illusion of coverage without the power of access.
Senator Cassidy, do you get the impression from your Republican colleagues that repeal of the individual mandate is something that would be necessary for a Republican response in order to keep the subsidies flowing?
Mandates from the federal government are coercive, and I think most Americans perceive as un-American. Most Americans do not want to be told by the federal government what to do. We accept income tax, we accept the draft in times of war, but do we otherwise expect the federal government to come in and say, if you don't pay this, we're going to penalize you? We're going to come after your wages? No, we don't. We don't expect the federal government to come to an employer and basically incentivize them to lay people off or to convert full-time workers to part-time in order to avoid penalties. And that's what the law does. So Republicans believe in freedom. We think the individual, the patient, should have the power, not a government bureaucrat. Republicans are all about repealing those individual mandates.
Jennifer Habercorn.
Senator, you cite the individual mandate, but one of the concerns that the insurers and health policy experts cite is that if you get rid of the individual mandate but keep the requirement that insurers accept everyone regardless of pre-existing conditions, that you're going to cause a death spiral, that the insurers are going to be overburdened with the people who are very sick and very costly to cover. So how do you keep the insurance markets afloat if you don't have that incentive for everyone to get in the pool and everyone to get covered through insurance?
First, we're seeing an incipient death spiral now. Again, some states, the insurers are requesting premium increases of 60%. And if you look at health insurance premiums since Obamacare passed, it's just skyrocketed. Healthcare costs flat, insurance premiums skyrocketing. That's number one. But let me go back to what I said earlier. Under the Patient Freedom Act, and also other Republican proposals, the state would have the option of enrolling someone unless they opted out. And so under the Patient Freedom Act, the proposal that I am supporting, you would either be on Medicaid, Medicare, Social Security, VA coverage, etc., TRICARE, or CHIP, something like that, or you get your insurance through your employer. But for those who do not have employer-sponsored insurance or public insurance, most of them would get a credit. And if they did nothing, the state would have the option of enrolling them in insurance unless they opted out. And that way you get greater participation than we have under Obamacare. Some would estimate as much as 95% participation. I think you probably heard me say earlier, in Louisiana, I am told yesterday, our rate of uninsured is still 20%. We can do a lot better than that. The individual mandate has been ineffective. We can replace it with something which is effective and which will protect those insurers from adverse selection.
Let me turn to Melissa Adias.
Senator Cassidy, so far we've been talking about a scenario where the government loses in King v. Burwell. I'm wondering if the government wins the case, does that secure the legacy of the health care law? How do you see that playing out going forward?
I think that the health care law is on tenuous ground. Health insurance premiums are increasing 20 to 60% across the nation. This is with deductibles of $6,000. We were told we had to pass the law to protect people from medical bankruptcy, and yet unpaid medical expenses are climbing because of $6,000 deductibles. I'm a doctor. I've been working in a hospital for the uninsured for 25 years. If you went to one of my patients who are good people and said, oh, you got to come up with $6,000 before your insurance kicks in, they would look at you like you're crazy. $6,000 for somebody who's having a tough time paying rent is impossible. People who work episodically, they paint a house, they make $6,000, and then they go 2 months without, and then they paint 3 more houses and make $18,000. They may get a credit, and then because they actually went too high, an Obamacare credit, next year it's going to be clawed back. And that's maybe between the houses that they are painting. Anyone that thinks that this law is working for working families does not know working families. I will concede, if you have cancer or ALS and it's giving you coverage you couldn't otherwise get, hey, I'm glad you have coverage. I would just say there's a less expensive way to get there. But for someone who doesn't use it very often, they're getting stuck with bills they cannot afford. It is a policy which does not work for working people, not for the patients I saw.
Senator, I wanted to ask you about your work with the uninsured. I know you've worked a long time in Louisiana's uninsured hospitals. Do you ever have patients or former patients come up to you and say that this law is a good thing, that they're getting coverage through it? Is there anything in this law has been in effect for 5 years that you've seen where it's having some positive impact?
Again, if somebody has ALS and they cannot otherwise get coverage, as a doc, I am so happy they are getting coverage. But more typical is the woman Tina from Jefferson Parish, Louisiana. And I always smile when I say this story because I didn't know where the conversation was going. She walks up to me and she goes, you know, I'm 56 years old and I've had a hysterectomy and I have no kids. I'm thinking, okay. And then she goes, and I'm paying $500 more a month for insurance with a $6,000 deductible. And I'm paying for obstetrical services and pediatric dentistry. Another woman walks up, she goes, I'm 58, my husband's 57. Unless my name is Sarah and he is Abraham, we don't need to be paying for obstetrical services. And by the way, my policy has gone from $12,000 to $22,000 a year. I said that on the campaign trail. A reporter wanted to fact check me. Oh, we look it up. No, she's wrong. It's now $25,000 a year. Those are the stories I hear much more commonly.
And Senator, what about stories of doctors in your profession? Do you think over the next 15 to 20 years we are going to see a decline in the number of primary care physicians because of the Affordable Care Act?
Doctors are discouraged. They're retiring early if they can. This plus other requirements like meaningful use is just so discouraging. I would like to think that that medicine is a noble field. As a doc, I could go into someone and know their most personal story and participate sometimes in saving their life. That is an incredible privilege. What you don't want is somebody who goes in with that motivation to be ground down by not looking in a patient's eyes to, when she has a diagnosis of cancer, reassuring her that all is okay, but instead having to log in onto a computer and click a box to say, yes, counsel patient about cancer. And by the way, also ask her about smoking cessation. That's what docs are now confronting. Obamacare is another layer of bureaucracy in which docs just feel oppressed by it. Instead of what they hope to do, which is to cure, they feel like they're dealing with bureaucrats. I want to give patients the power, and when you give patients the power, the patient-physician relationship strengthens. That is a much better system than Obamacare.
Melissa Adias.
Senator, you chaired a hearing this week on electronic health records. You just mentioned the issue of meaningful use. I'm wondering what opportunities you see there and what you think should be done to lessen some of those burdens that you're just talking about now.
Yeah, so there's three options. One, that first, we taxpayers have put up $30 billion with the promise that medical records would transfer easily between providers. And so if I go in here, my lab test from there is forwarded to here, I save the expense and the doctor treating me has immediate access. That has not happened. There's evidence that some of the major vendors of electronic medical records, as part of their business plan, are blocking access from other institutions to these records. Now, you and I paid $30 billion, and somebody as part of a business plan is blocking access. You and I should be very angry. So there's three things we can do. We can hope that industry collaborates to overcome the barriers that have been erected against interoperability, or we can ask that the administration do this. I'm told that ONC, the department that had responsibility of this, has had a department from the get-go over interoperability. If so, it hasn't worked very well. Lastly, we can pass legislation. To me, that's the least favorite option, but if that's what it takes, I am certainly willing to go there to give the taxpayer her bargain.
Senator Cassidy, this past week, Pope Francis issuing his encyclical on climate change, and he basically said that it is one of the, quote, principal challenges facing humanity. In your mind, is climate change for real?
So is climate change for real? That's actually, let me rephrase that question, if you will. I will stipulate, just for the sake of argument, that climate change is real. What I think people who ask that question, though, are presupposing is that it follows, therefore, that we must regulate the economy in a way in which they prescribe. Now, the Pope is concerned about the poor, patients that I saw in a public hospital. What is clear is that one of the major predictors of somebody's health is their job, their prosperity. Do they have income? There is such a strong statistical correlation between how well someone does financially and their health, whether or not their children go into crime, go into prison, or go on to go to college, all predicted by family prosperity. If we just stipulate, for the sake of argument, we need to worry about climate change, what I'm concerned about are the prescriptions which would destroy jobs. We heard this morning that like 4,500 jobs have been destroyed in Kentucky by the EPA's war on coal. That was said in committee hearing this morning. 4,500 jobs in Kentucky, whole communities devastated. Or this may have been West Virginia. And your only asset is your home. You can sell it to no one because everyone else has lost their home. The health of those people has just begun its decline. Now, I would rather move the argument to, what are we going to do to make people healthier? If somehow involving climate change, well, we should consider that if we can show that that really is what matters. But when we do that, let's not make them poor, because poverty is one of the major predictors of people not doing well in their health and every other aspect of their life.
So what's your reaction to this encyclical? He said basically that global warming is a moral imperative.
So I have not read it. What I was told, it is a moral imperative because those who are poor are those most likely to be affected. I will point out that we in the United States can do some good things. Natural gas, an American resource which creates American jobs, i.e. taking families struggling right now and gives them better jobs and better benefits, can be exported around the world, and we could create construction jobs by building LNG export terminals and maritime jobs by shipping it. And when that natural gas goes around the world, natural gas is one of the best BTU per carbon footprints there is. So if the administration is truly concerned about this, then we should do our best to take natural gas production to record levels and as soon as possible export it around the world. Let me also say one more thing. Keystone XL pipeline is predicted by the State Department to have a negligible effect upon global and life cycle carbon release, to actually save workers' lives because it is safer to ship oil through pipelines than over train and truck and barge, and it would also help create that prosperity for those working families that are struggling. Now, Keystone XL pipeline is something that we could do to address the moral problem of poverty and climate change.
Jennifer Haberkorn.
Senator, can you tell us a little bit how you feel like the relationship right now is between President Obama and congressional Republicans? I'm wondering particularly if the court does rule for the challengers in King versus Burwell. The president has already said that he wants a one-sentence solution that would simply restore the subsidies. Clearly, congressional Republicans don't feel the same way. There's a lot of space for potential negotiation there. Where do you feel like that relationship is right now, and do you feel like if the court did rule for the challengers, there is any room to negotiate?
A couple things. You can't fix a 2,700-page bill with one sentence. There's lots of problems with this. As we discussed earlier, since the bill passed, insurance premiums have skyrocketed as much as 60% in a state. Most recently, like a month ago or 2 weeks ago, were announced. 20%, 25% in Louisiana. You don't fix that with one sentence. If the president's goal is to protect a law with his name on it, there probably won't be any room to negotiate. But if the president will accept the goal I have, how do we take care of that woman who's been diagnosed with breast cancer and has to have insurance to pay for her chemotherapy? If we make her the centerpiece of our discussion, those people in Louisiana, 20% of whom are still uninsured, if we make them the centerpiece, not protecting the law, but taking care of patients, we're going to have lots of common ground. And I will come in good faith. For 25 years, I've been caring for the uninsured. My wife's a retired breast cancer surgeon. That description of that woman missing insurance but having breast cancer is one of her patients. I will meet him, and I think others will too. We care about patients, not about a law. I hope he cares more about patients too.
And a quick follow-up from Melissa Adias.
And we spoke earlier about the mandates and how that is a change that Republicans are seeking as a part of this response. What about some of these smaller provisions? Like today the House voted on a repeal of the medical device tax. Is that enough to get Republicans to rally around some sort of financial assistance, or is it going to take something more that's a pillar of the law?
King versus Burwell does not address the tax code. So if the medical device tax comes up, there might be some who are interested in that. But it actually is another part of the code, and we would have to go a little bit further afield to incorporate that. Melissa, what I've been focused on is the scope of King versus Burwell, which is first those 5 to 8 million people who may lose the coverage they have because the Obama administration implemented the law illegally, and then the states in which they live. What can we do to help bring coverage, access to coverage to those who currently do not, because insurance has become so expensive under Obamacare? Now, we can bring in a lot of other things, but from my perspective, I want to take care of those 5 to 8 million people, number one. And number two, I want to take care of those states, which right now are doing poorly under the law. What can we do to help those states do better and the residents of those states?
Senator, before we let you go, let me turn from policy to politics. Your colleague in the State House, Governor Bobby Jindal, is about to enter the Republican race. What are his chances?
Oh my gosh, I'm not going to, Bobby is, first I'll say Bobby, when he first ran for governor, no one thought he had a chance, and he came in a close second. So never underestimate the fellow. But right now you would just look at the polls and say that he's not in the top 10. So that would certainly mitigate against him. But I have not focused on that, frankly, Steve, beyond occasionally looking at the paper when I'm home. When I'm home, I talk to my mother, my wife, and my daughters, and I don't really, believe it or not, think about politics. I try not to. I try and think about my family.
Will you make an endorsement in the presidential race?
Whoever I think comes closest to a health care solution, which puts that patient in the middle of the solution, whichever candidate, she or he, that comes up with that, I will endorse that candidate. I am passionate. How do we replace that portion of the law repealed by King v. Burwell with something that gives the patient the power, not a bureaucrat, and gives access to insurance for those who currently cannot afford because premium costs are so high? That's the person I'll support.
And finally, Senator Vitter, your colleague running for the State House next year, will you endorse him?
I already have. David is a pragmatic man who will work hard. He's incredibly hardworking, and I think he'll do a good job as governor. There's other good candidates running, by the way, but I've chosen to endorse David.
Senator Bill Cassidy, Republican of Louisiana, joining us on Capitol Hill. Senator, thank you very much for being with us.
Thank you all.
Let's turn our attention to Jennifer Habercorn and Melissa Adias. And I'm going to begin with a sense of what's happening behind the scenes in advance of this ruling. If the Supreme Court does strike down the subsidy issue, what's happening at the White House and what's happening on Capitol Hill?
The White House has said publicly that there's not much they can do if the court does rule with the challengers, that basically it's going to be up to Congress and the states to fix this. The people I talked to say they assume that HHS is working on how they could, kind of flex some muscles through the regulatory process and make it a little easier for states to pursue setting up an exchange. But politically, it's in their benefit right now to say this is going to be, there's no way to fix this problem and Congress is going to have to do it. Hint, hint, Congress, isn't going to get their act together in time. On Capitol Hill, Republicans are meeting, talking about this, like Senator Cassidy mentioned. But I think there's a little more. The Republican Party, I think, is pretty far apart right now in exactly what they want that replacement to look like. There's some who want to restore the subsidies, and there's some who are very fearful of getting anywhere close to saying, I'm going to help out Obamacare. And I think that's going to be a really hard divide to find.
And I saw this headline earlier in the month from CQ Roll Call. It really is putting the Republicans in a quandary. Why?
Well, it's a very difficult situation for them because they've spent 5 years advocating for repeal of the law. They've spent many votes on repeal in the House. And now they're basically put in a position where they're going to have to find a way to help people who are benefiting, receiving subsidies under the law. And the challenge is that they don't want to be portrayed as helping the law, as continuing the law, because they've worked so hard and to portray the message that they want to repeal it. And that's going to be particularly challenging with the 2016 presidential election.
What did you learn today with Senator Cassidy?
I think Senator Cassidy is going to push really hard for his plan to King versus Burwell. I think I heard a little bit of apprehension for embracing the leadership outline. I think it's more generous to call it an outline than a plan at this point. And I think he's going to be one of those people who really wants to make sure that this is not perpetuating Obamacare.
Let me turn to another issue. We talked to him a little bit about climate change and this encyclical issued by Pope Francis, because the Republicans and Democrats embracing the Pope when he comes to Washington in September. And yet on this issue, you can see a real divide between what the Pope is calling for and Republicans on Capitol Hill.
Yes, there is a divide. I mean, I focus mostly on healthcare, but climate change is one of those issues that there's a deep divide between parties, just like there has been with the healthcare law. So it will be interesting to see how they respond when he visits.
And Jennifer Habercorn?
Same thing. I mean, I think, no Republican wants to come out and say, what the Pope is saying is awful, but they disagree with them. So they're kind of trying to thread that needle between the politically popular thing to do.
And finally, when the Supreme Court ruling does come down, we expect at the end of this month, give us a sense of what's going to be happening in this town. Begin with you, Melissa.
Yeah, sure. I think first you'll look for a sign from the administration, whether they'll immediately start calling for the subsidies to continue. That one-page solution we talked about earlier, if it does go for the challengers, and how quickly Republicans are able to coalesce around a plan. As we talked about earlier, it's still uncertain whether some more conservative members of the party would be amenable to extending anything that's linked to the healthcare law. So we'll be looking for the administration and Republicans as for what their opening bids are and what would undoubtedly be a very long and hard series of negotiations.
And one of the key justices, Justice Kennedy?
Justice Kennedy and Justice Roberts, I think, both could be a swing vote on this case. Justice Roberts upheld the individual mandate in 2012, so there's a lot of speculation that he's going to want to preserve that, and he's going to be looking at the court's legacy when he's making this decision. A lot of people were surprised last time when Justice Kennedy ruled against the ACA in 2012, and are wondering, if that's going to influence his decision this time. I think you need to look at the court decision. If they rule for the challengers as pouring a big tank of gasoline on the already simmering Obamacare divisions in Washington, it's just going to reignite them. And not only is it going to pose a policy problem for both parties, but a political problem. And there is no clear solution at this point.
Jennifer Habercorn, her work available online at Politico.com, and Melissa Adias of CQ Roll Call, available at rollcall.com, both on the healthcare beat. Thank you very much for joining us here on Newsmakers. We appreciate it.
Thank you.
Thank you.
C